church. Okay. Being here is always like being at home. So trying to be comfortable. Speaking in public is not my thing. I generally just, speak to people on one all day long. But I will get through this. Lolita asked me; she can ask me do anything, and I will find a way and make a way to make it happen just because she asked me. So, to Reverend Jackson, thank you for allowing me to speak today. And I wanted to just give an overview on mental health awareness. That is what I do. I practice psychiatry at the Lieutenant Colonel Luke, I think it's Wilson, Withers VA hospital. They just recently changed the name. So I see veterans from 18 to 108 for mental health services in an outpatient mental health clinic. Uh, and some of the general things that I treat veterans for begin with is depression, but not only veterans. It's a thing that any of us can identify with. Sometimes depression can be acute or it can be chronic. And when I say acute, I mean it's situational. Maybe you've lost a job, or maybe you've lost a loved one, or you just have a lot of stressors going on in your life. And whether it's acute or chronic, the symptoms are the same. It just depends on how long it lasts. Some people suffer from depression for years, for decades. But depression can show itself as sadness, feeling down. Some people feel irritable or agitated, loss of interest, and that can be a loss of interest in things that usually people are excited about. You used to love to go shopping or camping or playing sports, and now you don't. That's something that no longer brings you joy or pleasure. Low energy, difficulty concentrating or focusing. So, what you may see is having difficulties even at work. You can't get your usual job tasks done or completed. Changes in appetite, that can be a loss of appetite or an increase in appetite, even. Sleep disturbances, so either you're sleeping too much or you can't sleep at all, or you may have trouble falling asleep or staying asleep. And the most severe cases of depression may show itself as with people who have suicidal thoughts, and that is the most severe, where a person may have thoughts or even go forward with the actions to end their own lives. And we never like to see it get to that. Um, and I mentioned just life changes sometimes can cause people to feel depressed. It could be, loss of a job or loss of a marriage or relationship. Um, Changes in finances, all those types of stressors. Next, I'd like to speak on anxiety, which is the most common form of mental illness. It can also be acute or chronic. Excessive worrying, being fearful, being nervous or jittery. And these things can be triggered again by situational occurrences. Maybe you're anxious or nervous now because you hear gunshots, and that makes you nervous or anxious. Or maybe you were robbed, or maybe you were a victim of some type of crime. So all of that can sometimes cause people to feel anxious, nervous. Um, One of the most common forms of that causes anxiety is trauma. And at the VA, I treat a lot of people for post traumatic stress disorder, or PTSD. And their trauma may be caused by their military experiences. But what I find mostly is that they were already traumatized before they even entered the military, due to childhood traumas in the home. So, physical abuse, sexual abuse, neglect, emotional abuse, and then it's just compounded by the time they get to the military. But sometimes, it is just from military experiences. Many of them are teenagers when they enter, and now they're running and afraid for their lives. And that would make any of us, I think, nervous and anxious. The next thing I'd like to speak on are mood disorders. I think are more visually easier to acknowledge or understand, perhaps bipolar disorder and schizophrenia. That is like a common catchphrase now. Will if someone has, I guess, a certain mood or way about them, we'll throw out the phrase, they're bipolar. Okay. But bipolar is characterized as excessive or extreme mood swings, extreme highs and extreme lows. You may experience a person who is extremely happy one moment and they're busy and they're getting everything done and they're productive, and then it swings the other way and now they're really sad and they can't get out of bed. And also, this may present as mood swings with irritability, impulsive behavior. If you maybe have encountered someone whose behavior is very impulsive or reckless, they may have, lots of uh, debt or gambling, or maybe lots of partners, and that could be sexual partners or marriages. A lot of irrational and impulsive behavior you may see. Also, they generally can have difficulty in interpersonal relationships, and by that I mean they just can't get along with anybody. There's always trouble in relationships wherever they go. Trouble at work, trouble in the family. They just can't seem to get along with people in general, and or just kind of go along with social norms. Schizophrenia can present itself in, I think it's more, I think visually we can look at someone and you can probably tell that perhaps they have some type of delusional or disorder like schizophrenia, where they may have hallucinations. They may see things, they may hear things that the rest of us don't hear or see. With that, can cause aggressive behavior, a lot of confusion. They just can't function in day-to-day life, in having a place to live, keeping a job, managing just their day-to-day lives. Next, I'd like to speak about substance abuse. Probably not a person in this room that can't raise their hand that they don't know someone who has, or either they know someone personally or they know someone that knows someone that has been a victim or has suffered from substance abuse. Maybe you don't know anyone who's depressed or anxious or has bipolar disorder or schizophrenia, but I would bet my last dollar that you know someone who has had substance abuse issues. That can be alcohol. Yes, it's legal, but if it's done in excess and if it affects your ability to perform your day-to-day duties like work, and it affects your mood, then that is considered substance abuse. I guess we are more familiar with illegal substances like cocaine and crystal meth and heroin, and even though it may not smell like it in the state of Tennessee, marijuana is illegal, but and a lot of people don't feel that it is a harmful drug, but like any medicine, all things don't agree with all people. In alcohol, it can contribute to depression, and cause trouble sleeping, cause moodiness and irritability. Um, Another substance that people don't consider is caffeine. And coffee, energy drinks, sodas can definitely cause more intense anxiety and difficulty sleeping. So if you feel that you're jittery a lot of times or you have trouble sleeping, you may want to look at your caffeine consumption. Alzheimer's, it's mentioned in the bulletin, and Alzheimer's is a progressive disease. We sometimes intermingle Alzheimer's and dementia, but Alzheimer's is a cause of dementia, and there are different forms of dementia. But Alzheimer's destroys the memory and mental function, and by the end or the last stages of it has really debilitated a person almost to infancy, where they need help in all facets of life, dressing, eating, and all of their daily needs. Generally, it's diagnosed after the age of 65, but if it's diagnosed before that, it's called early onset Alzheimer's or early onset dementia. We've seen it as early as in the 30s, but that, or age, in the 30s, but that is very rare. Some characteristics of Alzheimer's can be memory loss, behavior, and personality changes. So that can almost mimic a mood disorder like schizophrenia. The person may have hallucinations. They may all of a sudden become very aggressive and violent. Along with the memory loss and just disruption to daily life, can have difficulty with familiar, tasks, how to make a meal or how to put coffee in the coffee machine, getting lost, driving home. Those are all kind of signs and symptoms that maybe something is going on. Repeating themselves over and over again. You may have had a conversation just 5 minutes ago and that person doesn't remember it, or they, act as if they have no idea what you're talking about. You may see changes in grooming, bathing, eating, may not want to eat, may not feel hungry. And, when you recognize these things, it's important to seek help because sometimes individuals with Alzheimer's can become violent in their confusion. They can be suspicious. They may feel that people are always stealing something from them or want to take their money, things like that. So it's really important to have the person see a medical provider. Hopefully, annually, all of you are seeing at least a primary care provider because they should be doing screenings as you progress through age. They do developmental screening, so from childhood into seniorhood for depression, for memory issues. So please stay in contact with your primary care provider. Um, if you know of someone who faces these challenges, or it may be you that struggles, it's a perfect time, I feel, to apply. A lot of the things that, I may have said here, but also Reverend Jackson posed the question, do you want to be healed? And you have to be intentional about your health, whether it's your physical health or your mental health, and seeking support and professional help when needed. It's a perfect time, I feel, to apply a lot of the teachings and things that we learn in church. I'm a believer in prayer and faith, but there's just some things we can't pray away, and we have to be realistic about that. Prayer helps. Prayer can soothe. Prayer can bring you peace. But it's no different than if you have high blood pressure or diabetes. Prayer is not going to correct those numbers. You have to be intentional, whether it's with diet or with medication, and your mental health is no different. The worst thing that you can do is to do nothing or to be in denial. So if you, can be in contact with a primary care doctor, let them know what you are experiencing. They can also offer you great resources for mental health, and in the bulletin or program today, Lolita has listed resources for you. NAMI, which is the National Alliance of Mental Health, on mental illness, mobile crisis, which is available for anyone in Shelby County. If you have a loved one who may become all of a sudden irate or irrational, or you feel, even psychotic, you can call them and they will come out, and they have trained professionals, including if the police is needed to come out and assess and help you get assistance for your loved one. Alliance Healthcare, which is all over the city, and anyone with TennCare can receive services there. Or if you are employed, most employers have an employee assistance program called the EAP, and they offer therapy or counseling, or they can refer you to providers if psychiatry is needed. Psychiatry is what I do. I do medication management, and I assess and evaluate people for mental illness and if medication is needed. If therapy is needed, I do very little of that, but I do refer my patients to therapy most often. So that's all I have to say. Thank you so much for giving me the opportunity to speak today. This is my passion. This is what I love to do. I don't feel like I work a day in my life. So I feel blessed to be able to do what I do. So thank you.
Thank you so much,